Hello everyone. Today we are going to discuss a very burning topic, that is how to crack NEET PG. I know you get endless question in your mind regarding this topic, that is how to read, what to read, how long to read, where from to read, and so on. So watch the video till the end. I will be answering all your questions, okay, and also I'll be sharing my NEET PG preparation journey with you, okay. So welcome you all to my channel. I'm Dr. Soumita Roy, pediatrician. I cracked my NEET PG in first go with an AIR of 3000, okay, and then I pursued my MD in pediatrics from a government medical college. So now you might be wondering that why to listen to someone who got a rank of 3000. Better to listen only to the toppers. But trust me students, only one or two of you are going to become toppers. Rest majority of you are going to get ranks like 1K, 2K, 3K, 4K and so on, okay. And I feel like ranks between 1K to 4K, 5K is a decent one, and you are going to get the subject, the dream subject of your choice with this rank. So let me answer your first question, that is what to study, okay. So, as you all are knowing, there are 19 subjects, okay. Students, you need to study all the 19 subjects, mind you. You cannot afford to appear in the exam leaving one or two subjects, okay. So, these 19 subjects are divided into preclinical, paraclinical, and clinical, okay. So, preclinical, you are knowing anatomy, physiology, biochemistry. Para comprises of micro, patho, pharma, FMT, commed, and clinical, the rest of the subjects, okay. So, what most of you are doing, the major mistake is you are devoting a lot of time to the major subjects like medicine, surgery, okay, and you are making the mistake of leaving the short yet high yield topics like psychiatry, pediatrics, or anesthesia, okay. This is a major mistake which most of you are doing, and that's the reason you are not getting good ranks, okay. So this cannot be done. You need to read all the 19 subjects, okay. And one tip I can give you is radiology is a subject which you might skip, in the sense that you are already reading radiology along with the other subjects. Like when you are reading surgery, you are reading the pertinent radiology things. When you are reading medicine, you are reading the pertinent radiological findings of those things, okay. That's the only reason you can afford to skip the radiology, because it's already absorbed in the other subjects. I'm not asking you to skip, okay. I am assuming that you are reading radiology along with other subjects. So other than that, it makes you 18 subjects which you need to read, okay. This is the thing, what to study. You need to study all the 19 subjects, okay. Next, moving on to your second question, where from to study. So yes, obviously you cannot miss textbooks, okay. Plus, along with textbooks, you need to follow either lots of online and offline platforms are there, students. You can follow either of them, okay, online or offline coachings, okay. Like I personally followed offline, I took a coaching from DAMS, okay, offline for a period of around 6 to 9 months, okay. So nowadays a lot of online platforms are there, but I will suggest you to stick to only one such platform, okay. If you're choosing offline, just stick to one particular thing, like either go for Marrow or Prep Ladder. What I found is many of you are doing mistakes is you are taking class from DAMS, you are taking online Marrow, you are taking Prep Ladder, and later on you are so much confused that what to read exactly, where from to read. I don't know, because I'm having so many things with me. I feel if you are following one particular thing very sincerely, that will do, that should suffice, okay. So, and textbook you can never skip, students, okay. So textbook and online or offline platform tutorials, okay. Now moving on to your next very important question, that is how long to read. Shall I read for 16 to 20 hours a day? No, 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 not at all. Okay, a person can never read for 16 to 20 hours a day and retain everything. Okay, so basically for that, students, you need to make a schedule and follow accordingly. Okay, it may vary from person to person. If I say that you read for 8 hours, 8 hours may be sufficient for somebody, but maybe not adequate for someone else. So it is basically variable. So I will tell you one thing. The thing which is very important and you should not miss that is your sleep. Okay, you should sleep for at least 7 hours. Okay, if you are getting more time, sleep for 8 hours. Okay, that will enhance your retention power. Trust me, do not hamper sleep. Okay, next, study. Okay, I will suggest you to study for around 8 hours. Okay, that may be plus minus 2. Okay, if you're studying 8 to 10 hours per day the entire year, I think that's quite sufficient. You will get a rank, don't worry. Okay, and see students, here 8 makes 16. Still you are having an extra 8 hours of relaxation. You can do anything you want in that time. Okay, so if you are dividing the 24 hours into 8, I feel that's a very good idea. Okay, so as I told you, it may be a bit variable. And one more thing, do not try to copy others, what others are doing. No, you stick to your own schedule. Okay, that will give you a better result. Okay, next, what to read, where from to read, how long to read, done. Next is your will, when to start preparation. So basically I did it at the time of internship, and I was very thorough with my subjects like pre-para and clinical subjects during my first, second, third professionals. Okay, and so that's why I took it up in internship. Okay, but trust me, you can start anytime you want, whenever you are self-motivated that yes, I can do, then only you should start. Okay, and you should give your full dedication, 100% dedication, and perseverance will give you a good rank, trust me. Okay, so like as I told you, I did it at the time of internship is a very good time to start your preparation. Okay, you are very serious by that time. Okay, but I have found lots of like students who have started already PG preparation from their first year itself, second year itself. Okay, I haven't done such because I was more into the textbook that time rather than the solving MCQs. Okay, but if they're very much motivated and dedicated from that time, I don't feel that's a wrong idea. You may do it. And one more thing, how later? I know a lot of you are already absorbed in your service after having done MBBS. Okay, you have appeared for this NEET PG for 1 or 2 times, you didn't get a rank, so you have lost your hope and you have been absorbed in your service. So it's not that you have been absorbed in service, that doesn't mean that you will never be able to get a rank in NEET PG. Then also at that particular stage of life also, if you are motivated, if you feel that you will be able to do, means 100% you will be able to do. Okay, so there is nothing such that you start your preparation at this particular time. Okay, you can do it anytime you feel like. Next is, will I be able to do it in my first attempt? I was never a topper in my entire MBBS, then will I be able to do it in my first attempt? Yes, you can. Okay, if you are giving 100% dedication, okay, definitely you can crack your PG in first attempt. Okay, undoubtedly you can do it. 100% dedication. Okay, and you need to follow a schedule as I had already mentioned. Okay, it's not that you were never a topper, that's why you cannot make it in your first attempt. This is just a misconception. Okay, now moving on to the next part, that is the strategy. So many subjects all together. Okay, such a big exam, what to do, right? So you need to have a plan, okay, for everything. So what should be your strategy? A minimum of 3 revisions. If you are giving at least 3 revision before your exam, I feel nobody can stop you from getting a good rank. Okay, but this 3 revisions is mandatory, students. Okay, that will help you retain whatever you have gone through in your preparation phase. Okay, and one more important thing, students, is you need to practice. As you all know, all are knowing that practice makes a man perfect. Yes, you need to practice as many MCQs as possible. Okay, so I feel this video will help you boost your energy for taking preparation for your NEET PG. Okay, and do subscribe my channel if you haven't done yet, and we'll be again meeting soon with a lot more important topics. Thank you.